Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Why do I feel sad for no reason? Potential causes and coping tips. Sadness is a temporary emotional state in which you may feel disappointed, glum, low, hopeless, helpless, despairing, and more. It's a normal human emotion. Sometimes, there are obvious reasons for sadness, while at other times, you may feel sad for no reason. /r/n/r/n Feeling sad for no specific reason doesn't necessarily mean you have depression. However, it does suggest you could be experiencing something more complex than sadness alone. /r/n/r/n Paper kites, Getty Images /r/n/r/n Your sadness could be depression, but keep in mind that depression is much more complicated than just feeling sad. It comes with other symptoms, including /r/n/r/n For a depression diagnosis, you must experience at least 5 of the above symptoms for at least 2 weeks, and 2 of those symptoms must be depressed mood or loss of interest. The symptoms must also lead to significant issues in your working life, social life, and other areas of life. /r/n/r/n Beyond depression, there are various possible causes of sadness. Some of these reasons can slowly creep up on you, which could explain why you feel sad but don't know why. /r/n/r/n Mood shifts, or mood swings, are a common phenomenon that can affect your quality of life. You may feel sad and unable to identify why simply because you're swinging into the next mood phase. /r/n/r/n There are many conditions and factors associated with mood swings, including /r/n/r/n They could be related to hormones, bipolar disorder, borderline personality disorder, BPD, substance use, attention deficit hyperactivity disorder, ADHD, stress, medication side effects, and more. /r/n/r/n There is a strong link between lack of sleep and depression. Getting adequate sleep, both quality and quantity, is very important for our overall health. The recommended amount of sleep for adults is 7 to 8 hours. /r/n/r/n Experiencing high or chronic stress can impact your mood. We often think of stressed out people as being irritable or angry. However, stress can also lead to a depressed mood, worry, loss of interest, and inability to enjoy yourself. /r/n/r/n Sadness over losing a loved one can be insidious and affect you even when you are not aware of it or not actively grieving. There are 4 stages of grief, and sadness can be felt in each one even in the long-term recovery phase. /r/n/r/n The weather and seasons can actually influence your moods and mental health. Seasonal affective disorder SAD is a type of depressive disorder that occurs during winter or, in rarer cases, during summer. /r/n/r/n The winter blues is a milder form in which you still feel sad during the darker, shorter days, but your mood does not quite meet the criteria for sad. /r/n/r/n Hormonal fluctuations, particularly of estradiol and progesterone, can greatly influence mood. Therefore, hormonal fluctuations could be the reason behind your sadness. /r/n/r/n Times of significant hormonal shifts, such as the following, can all lead to sadness. /r/n/r/n Some medications can cause sadness as a side effect. As discussed above, hormonal medications, like specific contraceptive methods, can cause sadness. General anesthesia medication given to you when undergoing surgery can also cause postoperative sadness. /r/n/r/n Medical conditions can impact your moods, but you may not even be aware that this is what is causing your sadness. These include conditions such as /r/n/r/n Sometimes it's easy to mentally shake off sadness once you're aware of it. Other times, it's a bit harder and you need some help. Below are some suggestions for working through your sadness. /r/n/r/n Discuss your feelings with your loved ones. Just expressing your sadness can make you feel better. It can also help your loved ones understand why you are acting a certain way so they can offer support instead of confusion or frustration. /r/n/r/n humor. Being able to find the funny aspects of a situation can be a protective factor against sadness and depression. Some ways to positively incorporate humor are telling funny stories or jokes, laughing at yourself, attending a comedy show, watching a funny movie, or reading a humorous book. /r/n/r/n Listening to music may help you cope with your emotions. A playlist of sad songs may be cathartic and help you get your feelings out. Alternatively, listening to upbeat, happy songs may help shift your mood. /r/n/r/n Participating in an activity you enjoy can also help shift your focus to the here and now and detract from your sadness. Try a hobby you love, sign up for a class, cook a nice meal, read a book, play an instrument, join a sports team, or call a friend. /r/n/r/n Sunlight exposure is associated with increased serotonin levels, a neurotransmitter associated with positive moods. People with untreated depression tend to have lower levels of circulating serotonin. /r/n/r/n It's perfectly normal for moods to fluctuate, and it isn't a bad thing. However, it's not good to feel sad most or all of the time. The following are tips for coping with sadness and keeping it from becoming overwhelming. /r/n/r/n Getting regular exercise is not only healthy physically, but it can also support your mental health. Exercise releases endorphins, feel-good chemicals, and signals to your body to release the amino acid tryptophan, which is then used to create serotonin. /r/n/r/n This is why you may feel a sense of euphoria after a heavy workout or long run, and it also explains how regular exercise can help with mental health in the long term. /r/n/r/n Practicing mindfulness techniques, such as meditation or breathing exercises, can boost your mood. Research shows that meditation leads to increased happiness, perhaps by encouraging you to live in the moment. /r/n/r/n Eating a balanced diet that includes whole grains, fruits, vegetables, and lean protein sources is linked to higher levels of happiness. According to the Centers for Disease Control and Prevention, CDC, most people in the United States need to include more dietary fiber, calcium, vitamin D, and potassium in their foods. /r/n/r/n Gratitude is known for having positive psychological effects and can increase overall happiness. Practicing gratitude in your everyday life, saying thank you more often or keeping a gratitude journal can help you improve your mood. /r/n/r/n Lack of sleep can lead to sadness, depression, and stress. Prioritize your sleep by practicing sleep hygiene and following daily routines that support your sleep, like /r/n/r/n Goal setting is another way to promote long-term happiness and well-being. Having a purpose and taking steps to achieve it can give you a sense of direction and accomplishment. /r/n/r/n One way to set goals is to use what is known as the SMART criteria, which stands for specific, measurable, achievable, realistic, and time-bound. /r/n/r/n There can be a fine line between sadness and depression, and ongoing sadness could also indicate an underlying medical condition. /r/n/r/n If your sadness persists for 2 weeks or longer, and especially if it occurs alongside other symptoms such as difficulty sleeping or weight changes, contact a healthcare provider. /r/n/r/n It can be confusing and defeating to experience sadness with no specific cause. Often, there is a cause, it's just a bit harder to identify. Underlying issues like medication side effects, hormonal fluctuations, grief, stress, and the weather can influence your mood. There are many ways to cope with sadness in the short and long term. It's also important to remember that sadness is a normal emotion, and it's okay to feel sad at times. /r/n/r/n rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.